Greetings, everyone. Welcome to the 1947 Partition Archive COVID Relief Series, being held specifically to answer your questions about the crisis that has struck Southeast Asia with the COVID pandemic. Joining us today will be Dr. Sushmita Roy Chowdhury. She is a pulmonologist and the head of pulmonology and pulmonary medicine at Fortis Hospital, Kolkata. She also looks after patients with chest and lung disease and is the lead COVID physician of her hospital. So, welcome, doctor. Thank you so much for joining us. I appreciate
Thank you.
your time.
Thank you for asking me
Uh,
to be here.
sure thing. All right. So, to start off, I'd really like to talk about the Delta Plus variant. Could you please tell us a little bit more about it?
Yeah. One of the disappointing things about COVID has been that people have kept abreast with what the virus is and what are the things that they need to panic about, rather than what are the things that they need to do to, prevent getting it. So
Mhm,
viruses, not just the COVID virus, but viruses, in order to continue to exist as a natural history, continue to mutate, which basically means they continue to keep changing shape and structure, because otherwise they're going to be killed and they're going to become extinct. As a result of that, when the viruses mutate, sometimes they are not of much importance, but sometimes there can be changes in the virus that can mean one of three things. Either they become more virulent, which means they can cause more damage to the humans when they come in contact with them, or they can, become fast, they can transmit themselves faster, which means that if there's a virus which is not very potent, it might affect three people. But if it becomes really transmissible, it might affect six people, which in turn
mhm,
means there are two people who are going to have the symptoms who are going to be sick at the same time. So it can either become more transmissible or it can become more virulent. And the third one, which you're always worried about, is that the measures that we are taking to counter the viruses, if the virus is going to be able to evade it. So, what do we have to counter the viruses right now? It's the vaccines that we have, it's the infection that we have, and we hope that we won't get reinfection, right? So sometimes the viruses change shape in such a manner that the vaccine that you're giving might not be as effective as you want them to be. And Delta variant is one of the more prominent variants in India at the moment. And on top of that, there has been a slight mutation in the spike protein, if you like, as we call it, the part of the virus that it uses to enter the human body, which has been found to be a little bit changed. And it has been seen so far by the scientific community that it renders the virus more transmissible, which means that it can transmit much more than the other viruses. Whether it is going to be more fatal or not, we don't know. But the only worrying thing that we know is that it can evade the antibodies. So as a result of that, it is possible that it can cause more disease, but it still remains to be seen because there are still a few number that are in our country, and we really don't know whether it's going to be a significant concern. So there's no point worrying about it just now. But what is important is we understand that the viruses will naturally change, and Delta variant is one of those changes. Delta plus variant, it transmits much more, but you can save yourself if you continue with COVID appropriate behavior. And the third one, whether it is going to be more fatal or not, we don't know yet. Time will tell. But prevention is always better than cure. So, masking up and COVID appropriate behavior needs to be continued at all times by all of us.
great. So, from what I gather, sure, there might be certain doubts about the vaccine being as effective against this variant, right? But something that's a sure shot, a foolproof approach would be COVID appropriate behavior and masking up. The numbers we see today are going down because of our behavior 2 weeks ago. So don't go out there, don't start partying, don't be in close social contact with people, don't remove your mask now because the situation can go from what it is right now to very bad in just 2 weeks, and we've already seen that. So please mask up to all our viewers. I think that's what the doctor is saying. And thank you so much for that. It makes perfect sense. Speaking about fatality and how contagious it is, I want to talk about what the virus exactly does to our lungs and if it leaves a permanent sort of damage. If you've seen those cases, could you tell us a bit more about this?
Yes, sure. So, so far, I think most people know what COVID is and what it does to your body. The simple things, if we remember, that it's a virus which is transmitted through air and through droplets. And as a natural process of our being, inhaling, which is taking deep breath in, and exhaling is a part of our normal living life, right? As long as you live, you're going to be taking a deep breath in and bringing a breath out. So if the air around you has the virus in it, then there's a chance you inhale it, and this virus or any other viral infections which happen in the lungs usually pass through the nose when you're taking a deep breath in.
Okay.
This virus, other than the other viruses that we know about, which is a seasonal flu, almost all of us get, fever 2 or 3 days, body aches, not feeling too well, sniffly, and then we get better. So, to about 80 to 85% of people, this virus will cause similar symptoms. In
Mm-hmm.
addition to, some people can lose their smell, some people can lose their taste for a few days, feel achy, feel a little bit unwell for about 5 6 7 days, and then get back on their feet. And
Right.
trust me, that is the most common presentation. But in about 15 to 20% people, it has been seen that the virus goes straight for the lungs. So lungs are a continuation of your respiratory tract. So when something enters your nose, it also goes via your respiratory tract down to your lungs. And this is why when you have COVID,
I think we just we're having a few connection issues with the doctor. I All right. So what the doctor was basically explaining was that the virus goes down your respiratory tract, in some cases infects your lungs, and I think the best move to protect yourself from this, from what we've heard all our specialists say and the doctor say as well, is make sure you're masked up, make sure you get your
to your lower
vaccine.
respiratory tract, which is the lungs.
She's back.
And this virus and once this virus goes into the lungs,
So we seem to be having a connection issue with the doctor, um, which our technical team is trying to sort out at this point. Something that I'd hoped on introducing to the show after a bit of research is this little piece of equipment. It's called a spiroball meter. And what it does is it tells you how healthy your lungs are. So, what you're supposed to do is inhale on it through this device and hold in the middle over here where the smiley face is, or whatever symbol your device has. And if you're able to hold it up until uh, it this this little lever here reaches the top, and you're able to hold it over there for at least 10 seconds or so, it's an indicator that your lungs are healthy. So, given the world that we live in right now and the new normal, I highly suggest that people get it so that you can measure yourself as of this point. And if you do get COVID, you will know at that point where your lungs are at and whether after you have recovered from COVID. So then you have particular data sets to measure your lung health, and you can take preventive action or you can take action post COVID to get better. This would be something that I read in a lot of research papers. I actually spoke to our pulmonologist here and a couple of other experts that we've had the pleasure of having on the show. So that is the gist of this spiral ball meter. Oh, here we have the doctor back.
I'm really sorry. The internet went off.
That's okay, doctor. That's okay. I was
Yeah,
just talking to our audience about this little spiral ball meter
yeah. Okay,
and
great.
how it can help us judge our lung health.
Yeah.
So yes,
So what I was saying, I think what were we discussing just now was
you were
how.
you were you were speaking about how it enters the lungs, and the lungs are a part of our respiratory tract.
Yes. So it enters the lungs and it can sometimes cause, a little bit of inflammation inside the lungs. As a result of that, parts of the lung become solid. And as a result of that, those parts are not able to make enough oxygen.
They
The
become
problem,
solid.
yes, this is the solid part. Lungs are spongy organs, right? So when there's infection, there is a collection of inflammatory material which renders that part of the lung as a solid area. And when the spongy area, which is supposed to do gas exchange, becomes solid, it is unable to do gas exchange. Oxygen making capacity of the lung becomes much lesser. And as a result of that, you don't feel breathless because there is a mechanism by which the reason you feel breathless is that your brain tells you there is low oxygen. But here, the brain lung mechanism is not at work. So, most people who have pneumonia in COVID do not realize that they have pneumonia or their oxygen making capacity is less until it has become really low, and which is what is called happy hypoxia. So most people don't realize that their lungs have been affected significantly until their oxygen levels are really low because of this phenomenon. And as a result of that, they arrive at a hospital much later. And, as a result of that, they suffer a lot. So therefore, one thing that we tell everyone, if you have COVID, there is one instrument you definitely must have at home, and that is have a pulse oximeter and check your oxygen levels at least 4 to 5 times a day as you're sitting and after walking. So, more than checking your oxygen levels while you're at rest, checking it after you walked for 3 to 6 minutes is even more important because it unmasks if your oxygen making capacity of the lung is good or not. Okay, so some people who have severe pneumonia
Yeah.
and they get to hospital in time and have not had treatment on time can end up with their lungs oxygen making capacity being much lesser in the long run if their lungs become stiff, which is what we call ARDS, and only 1 or 2% of people who've been affected with pneumonia will suffer from this. So the good news is that even if your lungs are affected, most people will recover from it. Only about 1 or 2% people will need to be in the intensive care unit and may have long term damage to the lungs. But most people, and I again reiterate, most people will recover. The main message to take away is if you have COVID, please buy a pulse oximeter. It doesn't cost much, but it might save you from lung damage if you are able to detect that your oxygenation is low. And when I say low, if you find that your oxygen saturations are below 94, you must go and visit a hospital and see a doctor to see if you have pneumonia.
Okay. Okay. I got that, but for our viewers, yes, the doctor says, just 2% of people will actually suffer with long-term damage post this pneumonia. But please do consider that you can be in that 2%, 1 or 2%, because the numbers are so massive. They're like in the millions, right? So just do the math yourself. 2% of, let's say, a million people who are sick, and then you get perspective on whether you can be one of them or not. Don't just think, oh, just 2%. Do the math and you'll see that the data is usually against us. All right. So just give me a moment. We have a question from Mr. Gautam Bhaduri. Good morning. What about my second vaccine, Dr. Sushmita? That's not a very clear question, but could you maybe just tell us in general about the second vaccine, the second dose of the vaccine, what to expect? Is it
I,
important?
it's a more a personal question. Dr. Bhaduri is one of our teachers. He was
Ah,
a he was the head of the Department of Ophthalmology in Medical College, Kolkata,
Okay.
and he had a severe reaction with the first one. So if
Okay.
you've had a severe reaction with the first one, then you don't go for a second one. So it depends. So first and second doses, depending on which vaccine you're getting, the government of India has clarified when you should be taking it. If it's Covishield, then the difference between the first and the second is 84 days. And if it's Covaxin, then it's 28 days apart. You take the two doses of the vaccines.
Okay. Okay. So wait, if you have a terrible reaction to the first dose, don't take the second dose. So what do you do then? Like you have to wait for like 5, 6 months to get another vaccine,
So
another
no,
brand?
again, there is risk and benefit ratio. Most people will be well enough, and there are some people who've had the first dose of the vaccine, and then
Hmm.
within 30 days or 35 days they get COVID infection. Okay, so the
Yes.
infection
Yeah.
the infection itself renders them with the antibodies that are required to protect them, so they don't need the second dose at that point of time at all. So what needs to be seen is, when do you get a booster dose, which is what you're asking, aren't you? So
Yes.
when booster dose. So usually if someone's had the first vaccine and they have infection within the first 30 days, you after 3 months you can get your second dose if you've had Covishield.
Okay. Okay.
Okay?
That's clear.
So
That is, yes, understood.
Covishield. Yeah. But
Okay. Okay.
if you've had the first infection, if you've had the first vaccine and then you
Hmm.
have COVID infection within the first month, you don't need to take your second dose of Covaxin, because the infection itself has rendered the immunity that you need, or the antibodies that you need from the vaccine.
Okay. That is clear. It's a simple enough thing to remember. Thank you. I was a little confused about that, but thank you, Dr. Baduri, for asking the question, and thank you, Dr. Roy Chaudhary, for for answering it. It's okay. That's one of those things I'll just skip over you if you don't pay attention. Yeah, you're right. Okay, great. Now, on the ground, as the director of pulmonary medicine at such a well-known hospital in Kolkata, right? What is the current situation that you're seeing? And if you'd like, you can talk about the third wave, the expected third wave as well, over here. Could you hear me, doctor? Okay, I think we're having another technical issue. Uh, Sorry. Okay, we can't hear you, doctor. So I think our technical team will have a quick chat with you if off screen, and then we will continue the interview. Great. So I'd like to share with the audience that I got my first dose of the vaccine yesterday, and given the reviews that I'd read, I was very afraid due to the brand of the vaccine that I got, but I feel fine. I do have a specific exercise routine during the week, so I feel pretty okay. I have some pain in my left arm as if I've done too many sets of a particular weight category, but that's it. And we have the doctor back. Can you hear us now, doctor?
I can, yes. I'm really sorry about this happening. I don't know why
No, no,
it
no.
is.
It's
Yeah.
okay. It's okay. I mean, you work hard to protect us. These small glitches can be forgiven. It's not a problem at all, doctor.
Thank
Great.
you.
So could you tell us about the current situation on the ground? What concerns you, the third wave?
So, you know, in the second wave, and for the last 2.5, 3 months, we've been really, really working hard, to the point that there have been people waiting outside our hospital, not just my hospital, everywhere in India, if you like, with no beds available at all. And we've been getting a breather only for the last couple of weeks or 3 weeks at the most, I would say. And until and unless we are, what worries me is that as soon as numbers start coming down, just as you said in the beginning, that what reflects today is what we did 2 weeks or 3 weeks ago. If we let down our guard and we do not continue with COVID appropriate behavior and we rush for, all the public places and the gatherings that our COVID fatigued minds want, we are going to end up in a third wave, which all the experts in this country have been saying can be as quick as 4 to 6 weeks from now. We and only we are going to be able to prevent it only if we restrain ourselves a little bit longer, wear those masks when we go out, and I keep reiterating that the only thing that saves most people is wearing a proper mask and maintaining the distance.
Mm-hmm, mm-hmm. But Kolkata was really badly affected, right? I think after New Delhi and Maharashtra, Bombay specifically, I think Kolkata was the third most highly affected one by the COVID uh, disaster that we saw a month ago at max. Um,
Yeah.
do you think the third wave will be worse? Is it even a thing? What is going on there? I can't get clarity from what I'm reading because it's all hypotheses until now. What do you think, Doctor?
So, again, you're quite right there. Most people who keep predicting things, I'm not sure they've been in a pandemic before. This is the first one for all of us. And
Right.
from history, what we know is that when there are viral pandemics, there are wave after wave after wave. But until and unless it turns out to be an endemic, which means that this virus is going nowhere. It's here to stay. How much we are going to be able to protect ourselves and how much we are going to be able to be strong against fighting the virus is what is going to depict how much of tragedy we are going to face further. And obviously, the third wave will completely depend upon how COVID appropriate we are going to be. If we continue to maintain masks and distance, and if any of us have any symptoms, we are responsible enough to isolate ourselves until and unless either we are diagnosed or the diagnosis is refuted. That kind of responsibility each of us takes upon ourselves. There will be a third wave, but it might not be as worrying as everyone's predicting it to be. Of
Yeah.
course, if we continue to do foolish things, that we take our masks off, we put our children at risk who are not even going to get the vaccine, then we are definitely going to see a third wave where the unvaccinated people are going to be victims. So it's in our hands which way we want this third wave to go. And if we, as we said, are responsible, each of us just takes our own responsibility rather than comment upon what who else is doing, I think we can make it much
Mhm.
better.
Yeah, I completely agree. I think the possibility of waves is not just up until the third one. If you don't follow norms that are there to, keep us safe, the waves are like an infinite potential. They can just keep rolling on because the virus keeps getting live hosts to infect. It keeps mutating because we aren't taking the right amount of care. So it really depends on us. Rather than reading newspapers and reading theories, we should just take care and it won't happen. That's
Spot on.
basically what you're saying, right? Right.
Yeah.
Okay. I'd like to talk about a specific group of people. Please don't feel attacked, but smokers, right? We know that smoking is bad for us. It's bad for our lungs in general, right? Given your experience on the ground with 170, 180 patients every day for the last year and a half, please tell us what the difference is between a smoker getting COVID versus somebody else, even if they're young, right? I'm sure you've seen some differences. Is the fatality rate higher? Is the damage left afterwards higher? What is it like?
Yeah, that's a pertinent question, and I think it's not about being attacked. It's just about being, informed. And then, despite being informed, if you continue to want to smoke, then it's your life. Who can say what you should do? But if you would take it from the get it from the horse's mouth, who's been seeing it every day, Please understand, the second wave is the wave that has taught us that it's not the comorbids, it's not the above 60s who have died, it is younger people who've died.
Mm-mm-mm.
And when I say younger people, younger males who are in their, most potential years of their lives, in the most performing years of their lives, between 30 to 50, is the
Mm-mm.
category where we've seen deaths, which was absolutely, it was devastating for most of us treating them. But despite doing everything, some of them just didn't make it. And smoking is definitely, definitely something that would put your immunity down, especially your local respiratory immunity. And if you have developed slightly tight airways in the form of COPD by having smoked, that puts you at even more risk of not being able to fight the virus. And I would definitely, this doesn't need science, this is logic. If you think of our windpipes as a chimney, and you think
Mm-hmm.
that in that chimney on a daily basis, you're putting in not just hot air, you're also putting in a lot of toxic chemicals as tar and other carcinogenic substances going in and day out for a number of years. That chimney, the insides of the chimney, are not going to be healthy. And when an unhealthy mucosa is affected by a virus, obviously it is not going to be able to fight back as well as a healthy mucosa would. So, smoking is one vice which I say. Some of my patients come and say, Doctor, I've done really well. I used to smoke 20, now I'm smoking only 5 a day. And I just tell them, this much poison and that much poison is the same. You're going to be killed with both. So
Mm-hmm.
you either smoke or you don't smoke. The day you stop smoking, you stop damaging your system. So quitting smoking is the best gift you can give yourself as well as your family, not just for COVID, but for many, many, many other diseases too. And
Okay.
I recommend.
Okay. So we've had a million reasons in the past, and now we have a million and one, right? With COVID being the added one. Great. Thank you for that. I hope my friends are listening, especially the one who requested me to ask this question to a pulmonologist. Please pay heed to the doctor's words. She knows best. Great. You spoke about COPD. What about asthma and bronchitis, doctor? Do these patients or do these individuals who are not yet patients need to maintain a particular amount of care? And what can go worse with them than than people who don't suffer with these diseases, conditions, rather?
Yeah, yeah, that's a very good question. So, a lot of what we need to understand is that COVID is a virus, and any kind of worsening of asthma or COPD, the one of the most common causes is a viral infection.
Right.
So, if you have asthma, the only thing you can do is ensure that the inhalers that have been prescribed to you, you continue to take them regularly as per your doctor, and you should definitely ensure that you're wearing your mask. When I say wearing your mask, I need to put in a word. Please, it's very nice to have cool looking masks that go with your outfit, but
Yeah.
if it's a mask that is a cloth mask, at best you're going to be able to get away only dust from it. It's not going to protect you against viruses and certain small bacteria. So
Yeah.
at least a surgical mask is what is necessary. You don't always need an N95 mask,
Right.
but a surgical mask, something that is going to protect you. Well, you can wear a surgical mask inside and your full mask on the outside. That's good enough. But please
Yeah.
ensure that you just don't go out wearing an inappropriate mask that is going to protect you
Okay. So I think uh, the backend team needs to take the doctor off screen again because she's having another technical issue. But her words are gold, though. That's a really good idea. If you have a cool mask that you want to wear, I have a Spider-Man mask that I really like to wear, but I do wear a surgical mask underneath it, and then I put the Spider-Man mask on. That's awesome advice. Because cloth masks can only protect us from dust at best. Um, for those of us who are concerned with infecting the generation that has brought us here and has given us everything, please do keep this in mind that even if you have had COVID, even if you've had the vaccination, yes, it is super, super key to mask up. Without it, as the doctor has mentioned so many times, we are putting not just ourselves at risk, but so many others, right? Um, and we've seen the disastrous impact that that has had. I mean, bodies are still being found, and uh, we really need to take care. We've gone through the worst, and we don't want to go through it again. So let's pay heed to the doctor's words. Who is back? Great. Hi, doctor. Can you hear us?
So sorry.
It's okay. It's okay, doctor. It's perfectly fine. Okay. You were saying yes. You were
Yes.
talking about
Yeah, masking up, using your inhalers properly is very important again. And if you have any infective symptoms, then see your doctor straight away. That is very important. Try not to be even a passive smoker, because passive smoking does absolutely the same amount of damage that active smoking does. So if you have a friend and they say, "Why can't you join me when I'm smoking?" You just tell them, "I don't think we are friends at all," because it's going to do you the same damage that
yeah.
your friend smoking his lungs away is doing to him.
Okay. Okay. Understood. Understood. From what I understand, Doctor, we have a few questions from the audience. So if the tech team could please bring them on screen. Brilliant. Partha Bhattacharya says, is ability to hold breath for some time an indicator of healthy lungs? How much time? Maybe we can explain using this device, or you can give
Yeah,
your own input.
so it's fine. So incentive spirometry is something that helps you do breathing exercises. Okay, so at least for 6 seconds, if you're able to hold your breath, that is what is good enough. But again, that is just an indirect indicator. And when we talk about COVID, it is important to know whether your oxygen levels are coming down or not. It's not how long you can hold your breath for, right? So that is more important. So breath holding capacity, the more somebody has, that's always indicative of a healthy lung. But with respect to COVID, I think we need to try and give out two messages. One is to assess if your lungs are getting involved or not, and the best way to find that out is to walk inside the room where you're isolated. Elderly people might not be able to walk for about 6 minutes. For them, about 3 minutes of walking is good enough. And if their oxygen levels are falling by 3% of their resting oxygen levels, then that indicates that there is early lung involvement. Or if your oxygen level is below 94, then you should see the doctor. Ideally, 6 minutes of brisk walking inside the room, check for that. When you are recuperating, when you have lung involvement, your breaths are short. You cough when you try and take a deep breath in. So from day 10, 11 onwards, if you start doing either incentive spirometry, because it shows you a ball, it can have either one ball or two balls or three balls. And when you take a deep breath in, the balls rise up. And how many balls are rising and how long you can keep them up, it gradually improves as you start getting better. And that can be an indirect marker for you to realize that, yes, my lungs are getting better. And it's an easy way to exercise. So that is how the incentive spirometer helps. If you don't have an incentive spirometer, doesn't matter. Just as Mr. Parthasarathi Bhattacharya says, take a deep breath in, hold your breath at least for 6 to 10 seconds, and then let it go. And push your tummy as you take a deep breath in. That's a good breathing exercise in itself as well if you don't have an incentive spirometer. But as you're recovering from day 10, 11 onwards, deep breathing exercises help you get better much quicker, as does
Okay.
awake proning. Proning is something that we must talk about in people who have COVID and are recuperating at home or in hospital. Sometimes what we found is if you lie on your tummy for about 30 minutes every 2 hours or so, oxygenation capacity improves of the parts of the lungs that are dependent and can get affected much more than the other parts. So oxygenation capacity can improve if you practice proning as well. There's lots on the internet about that. You can go through it.
Yes, I think the government took out documents as well, so it's best to go through official channels. Um, uh, Something that I forgot to mention earlier, even asymptomatic patients or people who think they're asymptomatic should get their oxygen, checked every few hours once they get a positive result, right? Because you mentioned hypoxia happiness, which doesn't let your brain come to know that you're breathless. So please keep that in mind, folks. We have a question by Ujjwal Kumar Banerjee. What are checks of the vaccine a person should insist on, or the vaccinator should disclose on their own? The question in respect of the recent Kaspa episode. I'm not aware of this episode, but if you are, please clarify Mr. Ujjwal's question.
So I think he's referring to an episode where the vaccination was not right, and it was. I think we'll not go into the politics, the details of it. But yes, if you have to be registered on the COVID app, and please choose. There are too many places that are opening up vaccination centers. Please make sure that the vaccination center has the government not to go ahead. Most people try and choose a vaccination center where there will be low queue, there will be less queues, which is closer to their homes, and choosing, going into malls and all that. Those were done so that it can be, the entire procedure can be faster. People don't have to go into a hassle of going into a hospital or a healthcare center to get it. But some of these unfortunate events are happening, and I would suggest that go to reliable centers only after booking an appointment on the COVID app, and ensuring that the center has a good reputation of having vaccinated a number of people in the past.
Great, great. Understood. So, do we have any more questions? I don't think we do. This has been amazing. Thank you so much for your words, Doctor. They are, priceless to us, especially at this point. Thank you also for your contribution in helping people survive this and get through this and get better. You're a true warrior, and so is your team. God bless you all. All the best for your mission, and we hope to have you on again. This was great for all our viewers. Sorry.
I'm really sorry about the glitches in the middle.
No, 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 no. It's perfectly fine. It's understandable. Thank you for your time. Thank you for taking time to fix the glitches. It's all right, doctor. Um, Now, for our audience who are interested in our COVID relief series, we will be hosting these episodes with specialists like Dr. Roy Chowdhury several times a week at 9 a.m. Please subscribe on Facebook and YouTube if you would like to know more and watch some more episodes. For today, this is it. Thank you, everyone, for joining us. Be safe and please, please stay masked up and display COVID appropriate behavior. Thank you.
Thank you for having me.